Good afternoon. I'd like to start today's press briefing. This is our periodic press briefing regarding Japanese government's response to COVID-19. My name is ONO Hikariko, Deputy Press Secretary of Ministry of Foreign Affairs, and I will serve as a moderator today. As usual, this briefing is being live streamed online, and we will take up questions from the online viewers of the registered international media. Also, we have already made available all the materials to be used during this briefing. So if there is any of online viewers who had not yet received those materials, please contact us at the International Press Division email account. First of all, let me introduce today's main briefers. On my right, we have Mr. Umeda Hiroshi, Director of Infectious Disease Information Surveillance Office, Tuberculosis and Infectious Disease Control Division, Health Service Bureau of Ministry of Health, Labor and Welfare. And on his right is Mr. Watanabe Shoji, Director General, Office for Novel Coronavirus Disease Control of Cabinet Secretariat. And on his right is Mr. ORITA Kentaro, Consular Policy Coordinator, Consular Policy Division, Consular Affairs Bureau of Ministry of Foreign Affairs. Lastly, on his right, Mr. MATANO Seiji, Attorney, Deputy Director of Immigration Department of Immigration Services Agency. Now I would like to move on to the opening remarks of today's briefers. Mr. Umeda, you have the floor.
As we have been introduced, I am from MHLW. My name is Umeda from Infectious Disease Information Surveillance Office. I would like to give you an update about the infection. As far as the material is concerned, I distributed to you 2 pages. The number of infected persons plotted. And in terms of Q&A, I have prepared for you a page for your reference. So first of all, please look at the blue graph. This is the latest update about the number of positive cases. The persons who are newly detected as being positive. There was first wave, and after July, there was a big wave coming, second wave. It's fair to call that. So you can see the developments chronologically. And as you can see here, as for the second wave, it peaked during the first week of August, then it started to decline, and ever since it's been remaining on the level. But come the month of October, the trend has been on the increase. That is our latest development. Particularly in terms of the region, Hokkaido, Tohoku region, a part of northern Kanto, and Okinawa. Those are the areas where increase have been noted. That's what experts say. What are the reasons for the spread, clusters in the entertainment area of local regions, cities, as well as dining together, and the workplace-related spread, as well as non-Japanese community-centered clusters. So clusters are becoming diversified and spreading throughout the region. So it's not on the decreasing trend because of those clusters observed. As for our outlook, we will analyze the cause for the clusters, why they emerge, and experts are working on it. And based on the findings of the analysis, appropriate measures will be taken to control the clusters. Early detection of the clusters and coming up quickly with measures accordingly. So those are the things that we will work hard on quickly And also, so far, there are certain findings. Experts are saying that eating together, drinking together is increasing in terms of the number of cases. And 5 scenes can be observed. And one can enjoy drinking and eating while controlling the infection. So PR is being done and communication has been done intensively with the general public. So gaining the cooperation from the general public, we hope that we can be successful in containing the infection. And towards that, we will also do our part. The experts are coming up with 5 scenes. And based on the latest findings, there are 10 knowledges which have been put together. So we have one more page of the material, a part of the 10 knowledge that we have come to know. So we would like to communicate it fully to the general public in the hope that we can get the understanding from the general public. And I have one more page of infection status. How do we compare against the cases of other countries? So if you look at the Japanese case, as you can see on the left one, there are per population of 1 million, how many infections are there. So Japanese case is written by red, which is on the base level, more or less, but compared with that, as you may know, Europe, France, Italy, Spain, UK, those countries coming to October have seen the surge of the cases. And if you go to the right-hand side, the graph, this is the number of deaths per 1 million people. So second wave, as you can see on this graph, compared with the first wave, in terms of the number of infections, the number tended to be large. But if you look at just the death, then compared with the first wave, the number of deaths has decreased quite significantly. Same here in Japan. Same trend is detected in Japan as well. So in terms of the confirmed cases, compared with March and April, the number is larger, but death as well as severely infected persons, if you compare with the past, currently the number has been quite low. So we are making utmost effort to decrease the severely ill persons as well as the number of the death. That's our priority. So that is it from me as far as the infection status is concerned. Thank you.
ただいま厚生労
So you had heard from MHLW. So presently, we have a little bit increase of the infection in Japan. So we will remain watchful over the future developments. And as far as our actions going ahead is concerned, please look at item 2 for April and May and July and August. We had 2 cases of increase of infection, and based on that, we will analyze and findings so that we can be more appropriate in taking measures going ahead. Based on the data and evidences, we will be prepared for the further increase of the infection, inclusive of foreign nationals as well. Looking at the entire population here in Japan, we will take every measure. So what are the preventive measures that can be taken? As you heard from MHLW, in daily lives, there are certain risk areas, 5 scenes, which have been proposed by the experts concretely. So there are actions which can be helpful in avoiding the infection risk, and there are certain cases where the probability of getting severe cases is high, like clusters, and clusters need to be detected early on so that intervention can be done early on so that one can avoid the death or the severely ill persons. So for that, we will cooperate closely with the local government body, and in the area where clusters had emerged on priority basis, PCR tests will be conducted very intensively and very strategically. Just lately looking at the local cities, there are certain entertainment scene where big clusters had emerged because of the eating and drinking together. And we are really directly communicating with the local government body so that intensive concentrated PCR tests can be conducted. If the infection spreads, then government will come in, the national government, and give guidances. Before going on to the total ban of the businesses, a limited measure will be taken, like shortening of the business hours and so forth, locally in a limited fashion. Those will be the precautionary sort of measures that will be taken. On the national level as well, like a health center personnel can be dispatched, or the function of a health centers will be secured, and secure the beds as well as the accommodation places so that accordingly the actions can be taken needed. So one more point is covered in my material. Item 3, this is a single page of a material, if you can take a look at it. New technologies will be introduced and diffused so that economic activities will go on together with simultaneous containment of the virus spread. So it's a new normal kind of lifestyle. Inclusive digitalization, innovative technology will be verified. This is very important, and we will do that and try to deploy it in the society, and also rationalize the limitations on the events. As a part of it, just October the 30th up until November the 1st last week at the Yokohama Stadium, a new technology was verified. The limit is only the 50% of the spectators against the capacity, and we wanted to verify whether risk can be controlled with a larger number of spectators allowed. So that was the verification purpose. In case of Yokohama Stadium, they can accommodate 32,000 at the maximum for the 3-day period. The first day, 51.2%. It was the Friday night on Saturday and Sunday, 76% and 86% fill up. And verification study was done accordingly. So the contents of the verification is that we use the highly precise camera, definition camera, to see how much people are clustered, crowded. If it is too crowded, inspector will go on and caution people. What about the concourse where concessions are there, or the toilets and so forth? People will be concentrated, so it will be watched, and within the stadium, camera will be installed. And also, the camera will look at the spectators, the high precision camera, to see whether spectators are really wearing the masks or not. So with a larger number of spectators, we wanted to verify whether the controlling would be possible or not. And using the line, we can detect the flow of people. And in toilet and lavatory, it's hard to picture, so we use the beacon. And if the smartphone holder will go into the lavatory cabin, then one can at least know how crowded the facility is through the beacon. And this data can be shared. And what happened to the spectators afterwards in terms of their health status, and we can also check that through the line and other communication device. And this coming weekend, 7th and 8th, Saturday and Sunday, at the Tokyo Dome, likewise, a verification work will be conducted. Yokohama Stadium is an open-door stadium, but Tokyo Dome is a closed stadium with a closed roof, and different from Yokohama. Of course, they are located in a heavily dense populated city area. There are subways and JR running, so situation is very different from Yokohama Stadium for the Tokyo Dome. So based on the findings of Yokohama Stadium, verification work will be done on the Tokyo Dome. We hope that we can get very informative data. And also, we are talking about new technologies, and throughout the governmental agencies across the board, we are always open to get the new ideas. effective technologies for corona control. About 400 pieces of proposals have come in. There was a SISTI, we have a Science and Technology Innovation meeting council, which have been launched by Cabinet Office, and you can get the information through that website. It includes already developed technologies done by the private sector. It's not totally new, so very near to the commercialization, full deployment. So based on the current rule, fourth activity, we hope the technologies can be encouraged to be used. It's obvious, but using the new technology, we hope to rationalize further the current sets of rules. So having that in mind, we are more than willing to have a across-the-board collaboration throughout all the government agencies based on the findings and the past track record. We hope to evolve and get better. Thank you.
Hi, I'm ORITA, Consular Policy Coordinator from MOFA. Thank you for joining us despite the very busy day. I'll brief on the government decision dated 30 October, as in the handout at the bottom, I guess, and touch upon some procedural changes that affect people who wish to enter, re-enter, or return to Japan. I have 4 points to explain here. First of all, regarding point 2 of the handout, as Foreign Minister Motegi announced on Friday, we lowered the travel advisory to level 2 on Australia, Singapore, Thailand, ROK, China, including Hong Kong and Macau, New Zealand, Brunei, Vietnam, and Taiwan. These countries were removed from the list of areas subject to entry ban. On the contrary, we announced to raise the travel advisory to level 3 on Myanmar and Jordan and designate them as areas subject to entry ban. However, this decision will not affect the entry of the people who follow the current cross-border travel procedures. Following the change of the status of these countries, the quarantine and immigration procedures of the existing cross-border schemes and tracks will be changed, such as the requirement of COVID-19 test before or upon entry. Please see the details on MOFA website. And we apologize that some of the English version is still under preparation, but it will come soon. Second, as of the 1st November, the business track between Japan and Vietnam was launched. Vietnam is the third country with which we have started the business track, which relaxes the 14-day quarantine requirement, enabling the users to conduct minimum business activities during the period. Third, regarding point 1 of the handout, also as of the 1st November, the government started new schemes to relax the 40-day quarantine requirement upon return from short business trip abroad. This scheme is aimed at those who live in Japan and travel abroad, regardless of their nationalities or their destinations, for basically less than 8-day period, come back to Japan and work at office soon after arrival. Like other schemes, users of this scheme are required to have companies or entities who reassure the compliance of the additional quarantine measures as prescribed in the designated written pledge form. Last but not least, also as of the 1st of November, we eliminated the procedures of so-called the letter of confirmation, kakunin-sho, issued at our overseas establishment, and also the receipt for request of re-entry, Juryo-sho, issued at the Immigration Services agencies in Japan. Re-entry permission holders are no longer required to submit these documents upon entry. We believe this will reduce their burden. Thank you very much.
Thank you all speakers for your opening remarks. Now I'd like to open the floor for question and answers. In fact, we have no international media reporters present here today, so I would like to take up some questions from online viewers one by one. The first question comes from Mr. Rocky Swift from Reuters. So the question goes, as Japan prepares to accept millions of potential COVID-19 vaccines, can the briefers explain more about the logistics? For example, where will they be stored? How will they be distributed? How will the government convince people to take them? What is the budget and procedure for dealing with any adverse health effects?
Well, thank you for the question. I am from MLGW who would like to answer your question. As for the vaccines, as you may know, presently the R&D of vaccines are going on. And as far as we are concerned, we are providing support to the R&D efforts. And when R&D is done successfully, and there come a time where the vaccination will come for our general public, then we will look into the production and supply system within Japan, and we will work at it to provide for an appropriate setup. As for the exact logistics, nothing has been decided. But as you had pointed out, when we say supplying the vaccines to the general public, it has a production and supplying system that will be needed, first of all. So we are considering how it could be done at this time. In vaccinating the general public, of course, the supply is limited, so that a priority vaccination will take place amongst the population. And the order of priority needs to be determined as well. So in making decisions on these things, the national debate would of course be necessary. Production and supply of vaccines will be provided for. As for the budgeting measures, in the second supplementary budget, it covers the support for the R&D support and the support for making things ready. 50 billion yen for R&D support and making vaccination possible, set up the environment for it. 145 billion yen or so have been provided for in terms of budget.
Thank you, Umeda-san. And we have other related questions regarding COVID-19 vaccines in Japan from Lisa Du of Bloomberg. Her questions are as follows. Could you give some more details on what the government's role is in the process to secure a supply, run clinical trials, and eventually overseas approval of COVID-19 vaccines in Japan? I understand some local pharmaceutical companies that are developing their own vaccines or partnering to distribute the vaccines in Japan have received funding from AMED, while some others have not. Does this impact the government's role at all?
Well, thank you for the question. And a part of it has been already answered in the previous question, but I can say something in addition. Involvement of the national government was a question. As said, we are providing support to the R&D as well as aiding the domestic system to get ready for the vaccination. Budgetary measures have been taken. so that a good system can be established. And one of it would include within the part of R&D, as you had pointed out. There are various kinds of vaccines which are being developed. And R&D of those vaccines have been assisted, like clinical trials within Japan and so forth. And associated support are given in that manner as well. Also, what else? Of course, there are domestic manufacturers, pharmaceutical manufacturers up there, but in overseas, maybe permit or approval can be given, and is there any assistance is made available? So when it comes to the concrete case, apart from that, instead of saying something about that, as I said, as a part of the overall framework for R&D support, many things are going on. And responses made by domestic manufacturers could be subject to our assistances. Thank you.
Thank you very much. And we have also received some questions regarding border control from Ms. Magdalena Osumi of Japan Times. Her questions are actually in Japanese, so I read it in Japanese.
Concerning re-entry, I have a question concerning re-entry. Now, at the time of re-entry, so there will be procedures that would not have been eliminated. However, recently, there are people who are outside of Japan who cannot return, who have residence status, and based on the measures that were implemented September 1st, so through the embassy or through the consulates, they needed to apply for a letter of confirmation for re-entry, but is that no longer required? And I have another question. Now, concerning travel advisory, reducing that to level 2, and as for the reduction of restrictions, Singapore from Taiwan, for the entry and re-entry from these areas, what are the procedures required? For example, testing prior to entry and also testing at the time of entry. So can you explain about that? And also when traveling from these regions, business track, residence track, we understand that is the only scheme that will be required. So how can you explain the permission conditions and procedures for each individual country and region?
I am ORITA from MOFA. I will speak in Japanese. So first of all, as for the re-entry related question, well, currently those of you who are abroad, who has a status of residence here in Japan, foreign nationals, and they have gone out of country having gotten the permit for the re-entry. So without going through the letter of confirmation procedure, so one can re-enter. But you have to caution, because as for the level 3 countries, if you have been there, staying there, then re-entry letter of confirmation is unnecessary, but continuously the pre-inspection certificate will be needed at the point of re-entry. So I hope you can exercise caution on that point, please. And going on to your second question. As for Singapore ROK, currently there is a business track going on with some countries like Singapore, ROK. Those are the two countries that we have business track, and the Vietnam, newly introduced partner. So for Singapore and ROK, it was level 3 when this system was operated. But it has been lowered to level 2 as of November the 1st, and the track has been ongoing. So there is a change made in the procedures. What are the changes? As follows. As for the residence track, in principle, the pre-test certificate is now unnecessary. And at the time of entry, the no need for getting the antigen test. As for the business track, at the time of the entry, no need for the test However, instead, a 14-day self-quarantine period will be eased, so they will be asked to take the pre-test in advance. However, those who are living in Japan and who have gone to those countries and have returned to Japan, and countries of a destination was less than 7 days, then the staying period was rather short, so that it's hard to imagine that people can get tested while they were there. So within the 7 days or less stay abroad in these countries, then after having returned to Japan, it's okay to receive a test after returning to Japan. At the Narita airport, within the terminal, newly the inspection space have been placed where you can pay and receive the test. So upon the arrival, if you pay a certain fee, you can receive the test immediately, and that will do as well. As for Taiwan, business track has not been implemented yet, so residence track will be the track right now to be applied. As said, in principle, pre-test at the entry point of a test are necessary. Thank you.
Thank you very much.
はい、どうも。
Questions from Ms. Motoko Rich of New York Times. First question is as follows. Are the stadium experiments designed to test Japan's capacity to host the Olympic next summer? And the second question is, as you are opening borders to some countries for business travel, is there a timeline for opening to tourists? So I think the first question will go to Mr. Watanabe. Thank you.
一つ目
Well, I'd like to answer your first question about the trial at the stadium. So Yokohama Stadium and the Tokyo Dome will be the stadium for verifying the new technologies. And come next summer, there is going to be Olympic and a Paralympic to be held. And it's not necessarily the case that those run up to the Olympic Games and so forth in terms of the trial. But verification will continue. And we are to verify the effectiveness and ask for the views of the experts so that various events can be held safely and securely. Those are the objective. That is a sort of a nexus that one can identify. Thank you.
2点目の
Can I answer your second point about the tourist? I am from an immigration services agency. As for the entry by tourists, at what timing, under what procedures they will be accepted, nothing has been decided as of now. Going forward, we will look at the infection status of other countries as well as other various developments, and comprehensively we will take them into consideration and eventually make a decision. Thank you.
Thank you. And we have one more follow-up question from Mr. Rocky Swift of Reuters. His question is as follows. Leading vaccine candidates, particularly Pfizer and AstraZeneca's, are in the phase 3 trials globally. But it only phases 1 and 2 in Japan. Will these vaccines be required to have phase 3 trials in Japan?
Thank you for the question. As for the R&D status, as you had mentioned, Pfizer and AstraZeneca are working on the phase 1 and phase 2 trials. So going forward, as for the phase 3, whether phase 3 will be conducted or not, and whether there is a request for it, of course, a consideration has to be made, but nothing has been decided for the future plan. However, we will look into the effectiveness evaluation and the safety of the vaccine and assessment and evaluation will be done. So based on the already received findings and the experiences, we will look into the future status of a clinical trial, whether it is needed or not, and so forth.
And we have 3 more questions from Patrick Walter of Frankfurter Allgemeine. The 3 questions are, question number 1 is, when do you expect that Japan is open up for business travelers from Europe? What conditions in Europe must be fulfilled for Japan to allow these entries? The question number 2 is, what is the reason that you see infection numbers going up in Japan, but death numbers are still relatively low? The question number 3, winter is coming and you see in Europe how this affects the infection numbers. Do you expect a similar development going to happen in Japan?
Let me answer your first question. I am from Immigration Services Agency. When will it be that business travelers from Europe will be accepted into Japan? It's same as a tourism case that nothing has been decided as of now. We will look into the infection status of Europe and other countries concerned. And there are countries with an entry ban and so forth. Whether the ban will be lifted or whether a different framework will be set for allowing for a certain entry, all these will be subject to further study and consideration. Thank you.
Mr. Umeda, please.
I'd like to answer the second question. I am Umeda. As for the number of positive cases, it's increasing in Japan, yet number of deaths are low. There are many elements and reasons, according to experts. First of all, the therapeutics are developed and it has been applied clinically. That's one thing. And also the test status and the healthcare provision status and regime compared with the first wave have become much better and have become more fulfilled, strengthened, so that early detection is possible and early intervention of care has become much more readily available. That is why we have been able to suppress the number of infections and the number of the death. And in general, as I said at the outset, the Japanese people are willing to avoid 3 Cs, conduct 3 Cs, wear masks, sanitize hands whenever possible, and so forth. And communication has been done quite intensively, and general public has been willing to comply with it and willingly try to protect themselves, and that's one of the big reasons. And also on top of it, even if you are infected, one will go to the clinic as soon as possible to receive treatment, and it has been quickened. Those can be reasons. And thirdly, what happens when the winter comes? About the second one, it's not only about domestic Japan, but in overseas areas as well. As I said, there is a surge of infected persons, but number of deaths compared with the first wave have been reduced quite significantly thanks to the experiences which have been accumulated. And I think a similar pattern is also seen in overseas. And going on to a third question, what happens when the full-fledged winter season comes here in Japan? And maybe the virus will get activated. So it can be a reason for further rise in the infection number. It is true that one tends to get confined within indoors. It's hard to ventilate the room that well. So it tends to be that people tend to get crowded within the confined spaces, particularly during the winter time. So the environment can be put into place where infection could rise. And it has to do with the humidity as well. So virus tends to get survived over a longer period of time. That can happen. And also one has to worry about the spread of the flu, influenza. That needs to be taken into account. There might be a simultaneous infection of flu and the COVID. So healthcare provision have to be put into place quite rigorously in time of coming winter. Because there are concerns out there, so good preparation will be made. Thank you.
Thank you, Mr. Umeda. Any additional comments or explanations? Mr. Orita, please.
すみません、一点だけ補足さ
Can I make just one additional comment? You talked about when will it be that Japan will accept business travelers from Europe? As of now, based on the 14-day quarantine, self-quarantine, throughout the world, inclusive of the Europe, Japan has been made open. So basically, those who have a status of residence in Japan and a short-term business traveler within the staying period less than 90 days, if those people are coming into Japan, then those people can enter into Japan. So within less than 90-day period stay, but 14-day self-quarantine will be needed. But if you can fulfill that condition, then of course, business travelers from Europe can enter into Japan. Thank you.
Thank you. It seems that we have already exhausted the list of the questions from the online viewers. So I would like to wrap up today's briefing. Thank you very much for your kind cooperation today.